Tonight, it's still not clear what role the federal government will have in gender transition care.
But executive orders could change how the government supports it, at least for minors. Thanks for joining us. I'm Latricia Thomas.
And I'm Kim Chapman-Whitfield. A federal judge blocked an order to pull federal funding when it comes to youth who are transgender. But some clinics are changing policies before any order affects them. Mary
Beth Mangrum spoke to one man who says that change puts his well-being at risk.
And I think the goal of these policies is not to protect the children or women necessarily, but to stop gender-affirming care.
Angel Pellegrino has received gender-affirming care for around 5 years now.
And I think that I'm starting to see the real effects of those policies.
He's been a patient with Cherokee Health Systems in Chattanooga for around half a year.
So I transferred here, and Friday was told that they were going to be discontinuing with gender-affirming care.
As for what they're complying to, CHS cites 2 executive orders in their letter to patients, defending women from gender ideology extremism and restoring biological truth to the federal government, and protecting children from chemical and surgical mutilation.
I found that so insulting. Just like, I'm not a child, and the whole idea of defending women from me, I guess, was just like bonkers.
For 40-year-old Pellegrino, losing that care,
I'm really scared for my mental health if I'm deprived of the medication that I need to feel like me.
Cherokee Health Systems sent that letter out on Friday, and we reached out to the provider about those changes and Pellegrino's concerns. They tell us that if not in compliance, they could lose federal funding, which could affect their ability to care for other patients.
CHS says throughout our history, Cherokee Health Systems has been committed to ensuring that all Tennesseans have access to high-quality health care across the widest possible array of comprehensive services. At the same time, as a recipient of federal grant funding, we must comply with relevant laws and regulations to continue access to care for all patients. They also say during this time, they'll be working with established patients to find care.
There is a giant question as to even if those people will continue to offer it.
In Chattanooga, Mary Beth Mangrum, News Channel 9.
Defense Secretary Pete Hegseth has been ordered to clarify the terms of the policy banning transgender people from military service. A federal judge made the demand last week. The Justice Department has argued the ban is not unlawfully discriminatory. The agency said it is a limit on people with gender dysphoria and not a broader ban on all transgender troops. But the judge pushed back, questioning why the policy fails to define gender dysphoria, and noted the policy could violate the Equal Protection Clause.